well, you know, the average doctor, and I was being relatively kind in the sense of saying that they see 3 patients an hour. It's more than that, right? If you work a 40-hour week, you know, that's 120 patients. Yeah. And then if you multiply that by a month, you know, that's somewhere close to 500 patients in that month. If you go to your doctor and you see them, and they need to order some tests, you know, an image, something like that. How long do you think until you're back in the clinic discussing those tests with that doctor?
A month.
A month, fine, a month, right? By the time you get your blood work, you know, you get it set up, the blood work comes back, you know, somewhere 2 to 6 weeks. Let's say a month.
They don't know who I am.
They don't know who you are. Yeah, let's say you were a new patient. By the time you come back, that person has seen 500 other people. 500 other people that they've had to do this with. Yep. They don't remember who you are. Nope. And because of that, the only thing that they can do, and that, by the way, that's also if you do see the same person. Yeah. And because of that, they can't go based off on you, like what you said, the specific things that you said.
They don't know me.
They don't know who you are.
They know me from a paragraph they read on their chart at that point.
And more so, they know you by your test results.
And my test results.
And maybe that is one of the more glaring flaws and that people need to understand of our healthcare system, because we look at these tests, you know, and I'm specifically talking about MRIs and X-rays. Mm-hmm. We look at these tests and CT scans as like the gold standard. Like if it shows this, this has to be accurate, and it's not. Yeah. It's not. And we have so many studies out there that show, you know, that if you are 40 years of age, somewhere around there, and you go and get an MRI or a CT scan or an X-ray without any symptoms whatsoever, you're going to have findings. You're going to have a bone spur, you're going to have a torn labrum, you're going to have meniscus degeneration, you're going to have disc degeneration, you know, DDD, you're going to find a herniation, you're going to find some spinal stenosis, you're going to find stuff, right? Yeah. You're going to find arthritis.
But not necessarily all problems.
Well, remember, this person had no symptoms whatsoever. Exactly. So they weren't you know, just because they were there, they weren't causing any pain. But now you are in pain, you go to the doctor, they do these images. Whatever they find on these images, they're going to use to explain your symptoms. Yeah. Or let's say they don't find anything, kind of the same thing. Like, all right, you didn't find anything, but I'm in pain. Yeah. Right? So what do you do? And the answer is you have to do something that, well, how long is your visit with these people?
10 minutes.
All right.
Yeah.
So
once I'm in the room.
You have to do something that takes 10 minutes or less. Yeah. And you remember, like, once you're in the room, once they're in the room with you, this is, you know, saying hello, a little bit of chit chat, why are you here, you know, a little bit of poking and prodding, stuff like that. So they have to give you a treatment that can't take longer than 10 minutes.